Hi, I am going to be depicting a situation in which a day shift nurse receives report on a patient being admitted to a cardiac unit from the ER, but the patient doesn't arrive to the floor until after shift change, and so I will be giving report to the night shift nurse even though the patient hasn't come up to the floor. This type of situation has happened several times on the cardiac unit that I work on at the hospital, at my hospital. And so it sets the stage for miscommunication and puts patient safety at risk. So here I go. Hello, this is John on PCC. How can I help you? Hi, how are you? Good, yes, I'm taking that patient. Yes, I'm ready for report. Okay. 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 All right. So I have Mr. Smith. He is a 67-year-old male being admitted today for syncope. He fell at home. CT scan came back negative of his head. He does have a Foley in place for urinary retention. Full code, no known allergies. He's on room air, clear. Vital signs stable, last blood pressure 119/68. Heart rate's in the 70s and running normal sinus rhythm. 20 gauge in the right forearm. Normal saline running at 75. Perfect. I got it. No, I don't have any questions. Thank you so much. All right, bye-bye. So now I am going to give report to the night shift nurse. And this is, the patient's not even up on the floor yet. All right, so, are you ready? Okay. So I have Mr. Smith. He's 67 years old. He was admitted today, full code, no known allergies, for syncope. So he's just basically getting the cardiac workup. He's going to get an MRI done tomorrow. Assessment-wise, it's pretty much unremarkable. Skin intact, he's on room air, clear, 20 gauge in the right forearm, normal saline running at 75. They did on the monitor downstairs, he was running normal sinus rhythm. Not a diabetic, on a regular diet, but yeah. Alert and oriented ×4, pretty easy patient from what I hear. Okay, are you all good? Alright, cool. So, this is, like I said, this has been a problem on my unit. It's happened several times. One thing that one thing that I didn't mention in report was, well, I did it intentionally, was that the patient didn't have a Foley, or the patient had a Foley, sorry, and the patient fell prior to admission. Those are two big things. And so this is just an example of what can happen when you don't do bedside reporting and you give an indirect report to the oncoming night shift nurse, for example. So according to the article, What Counts as Effective Communication in Nursing, the quality of communication and interactions between healthcare providers and patients has an important influence on patient outcomes. So, and nurses have a key role in meeting communication needs of patients. But not only that, we as nurses and healthcare professionals need to be aware and have effective communication with our colleagues as well. So, for instance, with this patient, the fact that the patient had a fall prior to admission and that wasn't passed on in report, the night shift nurse is not going to have any idea upon initial assessment that the patient even fell. And when you do your charting and you do the Schmidt scale, for example, that's one of the questions, and so you're going to get an inaccurate and an unclear picture of what is going on with the patient. So there's going to be this gap in communication, and therefore, it doesn't improve patient outcomes, and it doesn't enhance patient satisfaction. What I would have done differently, I think management needs to get involved since this has been a recurring problem. Perhaps there needs to be a policy put in place stating that ER nurses are not allowed to call up to the floor and give a report from during a specified time frame, for example, between 6:30 and 7:30, whether that be AM or PM, just so that there is not that gap in communication and we don't put the patient safety at risk. But yeah, so if I was being the nurse receiving report right before shift change, I would have let the ER nurse know that to call back and to call back after 7:30 and give report, because knowing that that's a time when we're getting ready to do shift change, and we don't want that miscommunication. We don't want that indirect report given to night shift. So yeah, like I said, it's happened several times on my unit, and even with me a couple of times, and it's frustrating. It's and actually this has happened where I receive an indirect report and I assess my patient, and I find that they have a Foley and I wasn't told that. Some things like those are, I feel like, big things to mention. But yeah, communication is key in nursing, and so this gap in communication that's been occurring on my unit is very dangerous, and management needs to get involved to solve the issue.